The doctors stood stunned when they saw two giant insect-like creatures wrapped around the patient's heart. What should have been a routine open-heart surgery had turned into something never before seen in medical history. The surgeons were utterly helpless and immediately called in a top specialist overnight. The specialist looked at the scene, drew a deep breath, and raised his scalpel. But when his eyes fell on the branch-like vessels spreading around the heart, he stopped. He realized that even if the centipedes were destroyed, those vessels would not come away, and the patient's death would be certain. The only hope now was that those creatures would detach from the heart on their own. To understand the case, identifying the centipede species became crucial. The specialist carefully made a small incision in its body, but the creature reacted aggressively and tightened its grip even more. Alarms blared. The patient's heart began beating wildly, and his life hung in the balance. Drugs were administered, and only then did the situation stabilize. Although a sample had been secured, a new problem emerged. The vessels spread from the heart had already reached the patient's IV lines. Seeing how quickly this was happening, the specialist panicked because it meant time was running out. Investigations revealed that this was not a natural organism but the result of human genetic experimentation. The path to saving the patient led only to the scientist who had created it. Police soon caught a suspect, but when they opened his bag, the specialist's anger exploded because the man had already died from a gunshot to the head. His brain was completely damaged and all traces were erased. The situation was perilous. In desperation, the specialist decided to deliver an electric current to the dead scientist's brain to rouse any remaining consciousness. The body convulsed when the current was applied, but the experiment failed. Only one last, extremely risky option remained: connecting that dead brain to a living person. An assistant was chosen for the dangerous procedure. One tiny mistake could cost him his life. 2 attempts failed. Then the specialist gave the assistant a stimulant injection to bring his brain to full activation. The assistant mustered his courage, the specialist increased the current, and finally, success. The assistant quickly wrote on a piece of paper what had flashed into his mind. It was the solution. The specialist immediately prepared the drug and injected it into the patient. Within moments, the venomous grips tightening the heart began to wither, and the centipedes slowly disintegrated. In the end, the patient's life was saved.